smile makeover is different for every patient. Some patients need just simple things done, fixing one tooth, fixing two teeth, and others need a full mouth addressed because they have broken teeth, worn down teeth. Anybody who has a smile concern is probably a good candidate for a smile makeover. A smile makeover doesn't mean it's some big complicated thing. It really can be the small things that make a big difference in a smile. So when a patient comes in with a concern, we address exactly that concern, and they leave with the smile that they've always dreamed of. Sometimes people really do think it's a big complicated thing to fix something, and oftentimes people are surprised with how easy it is, how painless it can be. Sometimes we can fix things without numbing a patient at all, and it's actually very easy. So I would just say, come learn what your options are. After smile makeovers, a lot of patients will say, I wish I had done this sooner. They've thought about it forever, they've looked at it in the mirror, they've had this concern, and they just kind of try to hide it. So they do some easy thing and they never have to think about the concerns again. I got really excited about smile makeovers after I was able to help some people who have told me they didn't smile their whole life. So they've lived their entire life without really feeling like they could smile. And then once we finish the smile makeover, they don't stop. And so I see someone that's life has changed because they came in maybe not looking very friendly or not very happy, and they leave looking happy and friendly and talking to everybody. And that kind of change for me is a lot more than just fixing a tooth. It's really helping a person.